Okay. Good evening. Am I audible now? So if Zoom is full, I provided the YouTube live link. So if those who can't join, you can join with the YouTube live link. All are requested, please open your windows. Let me take energy from your smiling face. Suswagatam. You are all welcome to Saspandan TCM Academy. I am Vivek Rane, practicing acupuncture from last 40 years. Along with the acupuncture, I am practicing quantum physics, radionics. I am also practicing the sound therapy, resonance frequency. So we are discussing on the migraine from the yesterday. So we discussed yesterday migraine headache have the 12 patterns. 12 patterns. 8 patterns are excess pattern and 4 patterns are the deficient pattern. So we are discussing excess patterns. So today we discuss the excess pattern, damp heat. Because of damp heat or from the exogenous factors. So migraine cause headache. Okay, it's caused the migraine because of damp heat, exogenous factor. So while the working with the damp heat, our treatment principle should be clear damp, drain heat from the liver and the gallbladder, transform dampness, open the Shaoyang, clear head and relieve migraine, and harmonize the middle burner. This pattern always present, always come with the throbbing headache, especially temporal. Then comes with the heaviness of the head, bitter taste in the mouth, nausea, dizziness, chest or hypochondric fullness, and sticky stool, yellow greasy tongue. When you see the tongue of the patient, okay, that is the yellow greasy tongue coating and a slippery and rapid pulse. So points are GB34, gallbladder 34. This is the cheap point to clear damp heat from the liver and gallbladder. And this point benefit the Shaoyang channel. Then second point is the GB43. This point clear gallbladder heat and benefit temporal migraine. Next point, liver 2. Liver 2 clears liver fire and heat. Then next point is the SP9. SP9 drain dampness and promote fluid metabolism. The next point is the ST40, stomach 40. This is the empirical points or the resolve the flame and the dampness. And this point clear the head. ST36, stomach 36. Stomach 36 strengthen the spleen and support the transformation of dampness. The next point, triple armor 5, HA5. This point opens the Shaoyang channels and relieve temporal headache. Next point is the GB20. GB20 clear wind and heat, relieve migraine and the dizziness. Then gallbladder 8, GB8. This is the primary local point for the temporal migraine. LI10. This point clear excess heat and reduce inflammation. LI4. LI4 moves chi and relieve headache. This is the analgesic point of the body, LI4. Taiyang. Taiyang. This is the local point for the temporal migraine. And CV12, this point harmonize the stomach and the middle burner and transform dryness. One important thing, I am telling you this point, but which point you have to use, which point you have to prick, you have to decide as per the symptoms. Okay, this point is working with this damp heat migraine. But plus minus symptoms are there, you have to decide which point you have to use. Then needling technique, how to needle, which point you have to sedate and which point you have to tonify. For sedation, GB34, GB43, liver 2, SP9, ST40, triple armor 5, GB20, GB8, Li11, Li4, Taiyang, and CB12. This point you have to sedate, and you have to tonify only ST36. This is the granary point of the body, ST36. And you have to retain needle for 20 to 30 minutes. Now, very important. Yes, CV12 also sedate. Very important. You have to arrange this protocol as a meridian circuit flow. So meridian circuit flow is the CV to stomach, stomach to SP, SP to stomach, okay, SP to GB, GB to SJ, HA to liver, liver to large intestine to GB, GB to Taya. You have to keep sequence like this. So treatment strategy is the number one point is to transform the dampness and strengthen the middle jaw. You have to use CV12, ST36, SP9, and ST40. ST40. All 4 points we have to see. Then secondly, you have to clear damp heat from the liver and gallbladder. Okay, so points are GB34, GB43, triple armor 5, and liver 2. Then third, you have to clear excess heat and move chi. Points are Li11 and Li4. Fourth step, you have to treat the migraine locally. So GB20, GB8, and Taya. These are the local points. And this sequence follow a logical TCM treatment principle of treating the root first. We have to treat what is the root? Root is the dampness. Okay, damp. We have to transform the damp and strengthen the middle jaw. This is the root. So dampness and the middle burner dysfunction. Then clearing the branch pathology. That branch pathology is the liver and gallbladder damping. And finally, treating the local headache symptoms. GB20, okay, and Taya, and GB8. Now, our next pattern, this is also excess pattern. Wind pull invasion. Wind pull invasion is the excess pattern. So treatment principle is the expel wind, disperse cold, release the exterior, open the Taiyang and the Shaoyang channels, promote circulation of qi and the blood, and relieve migraine pain. And typical clinical features are acute headache after exposure to cold wind. In this pattern, symptoms are acute headache after exposure to cold wind, occipital or vertex headache with the neck stiffness, aversion to cold. Okay, patient do not like the cold. Patient have the mild fever or no fever. Then absent of sweating. There is no sweating. Clear nasal discharge. And thin white tongue coating. Okay. If you see the tongue, there is the thin white tongue coating. And if you see the pulse, pulse is the floating and tight pulse. So points are GB20. This is the main points to expel the wind and disperse the cold and relieve headache and stiff neck. GB20. We are always using GB20 for the expel wind, disperse cold. Next point is the bladder 12. Release the exterior and expel the wind cold. Bladder 12 is the wind gate point. Okay, note down it. Bladder 12 is the wind gate point. Then bladder 10. Bladder 10 relieve occipital headache and neck rigidity. Then DU16. DU16 expel the wind and benefit the head. Then Li4 release exterior, expel wind and relieve headache. Then Li4 or LU7. LU7 is the open the lung channel and release the exterior wind pool. Triple hormone 5, expel wind, benefits the Shaoyang channel and relieve temporal headache. GP8, primary local point for the temporal migraine. Taiyang, local point for the temporal headache and migraine. And DU20, this point clear the head and relieve pain. And SI3 is open the Dume extraordinary vessels and benefits the occipital headache and the neck pain. So needling technique, we have to sedate and tonify. So sedation, GB20, bladder 12, then bladder 10, DU16, Li4, LU7, triple armor 5, GB8, Taiyang. And you have to use even method, no sedation and no tonification for DU20 and SI3. and you have to use the moxibustion. You have to use the moxa on bladder 12, DU 16, and GB 20. When cold comes, when cold predominate and there are no sign of heat, you have to retain the needle up to 15 to 20 minutes. Now, time to discuss the meridian circuit. So, what sequence you have to use to promote this protocol? So, lung to large intestine to small intestine to DU meridian to bladder to HA meridian, and HA to GB meridian, and GB to Taiyang. So, number one, you have to release the exterior wind cold. Points are LU7 and LI4. LU7 and LI4. Secondly, we have to open the DUMI. Points are SI3, UB62, and DU16 and DU20. Third, you have to open the Taiyang channel. Taiyang channel. So for that, you have to use bladder 12 wind gate and bladder 10. Number 4, try to open the Shaoyang channels. Use point GB5, triple armor 5, GB20, and GB8. Number 5, for local migraine relief, Taiyang. So, chief points is the GB20. This is the primary point for the wind cold migraine with the occipital or the temporal pain. And recommended distal combinations is the LU7, LI4, SI3, and HF5. Okay, so next pattern is the wind heat invasion. Wind heat invasion. To treat in a wind heat invasion, we have to follow the principle that expel wind, clear heat, release exterior, clear head and eyes, open the Taiyang and the Shaoyang channels, and relieve migraine pain. And in case of wind heat invasion, symptoms are typical features are acute headache after exposure to wind or heat. temporal or frontal migraine, fever, slight aversion to wind, slight aversion to wind, sore throat, thirst, red eyes, yellow nasal discharge, thin yellow tongue coating, and floating and rapid pulse. Okay, so points we are using GB20. This is the cheap point that expel wind and clear heat, relieve headache and neck stiffness. Secondly, Li4 release the exterior, expel wind, relieve headache. Then Li11 clear heat, reduces inflammation and relieve fear. Relieve fever. Then triple or 5 expel wind, heat and open the Shaoyang channel and relieve temporal migraine. Then DU14 clear exterior heat and release the exterior. Then DU16 expel wind and benefit the head. GB8 primary local point for the temporal migraine. Taiyang local point for the temporal headache and the migraine. LU10 clear lung heat and benefit the throat. LU11 clear wind heat from the lung channels, and this point useful for the sore throat. So you have to prick to bleed in acute cases. Okay, so take a lancet and prick the this point and press it. Blood will be come out. Minimum 15 to 20 drop blood should be taken. So needling technique, reducing, that is the sedation technique first, GB20, Li11, Li4, triple armor 5, DU4, DU16, GB8, Taiyang, LU11, and with the E1 method, DU20. So, bloodletting option for acute excess heat and severe sore throat. So, experienced practitioner may consider LU11 or ear apex bloodletting where clinically appropriate. Amoxibation is not recommended as this is the exterior heat pattern, and you have to retain needle up to 15 to 20 minutes. Now, meridian circuit. First, release the exterior and wind heat. Release the exterior and clear wind heat. For that, LU11, LU10, Li4, and Li11. Secondly, open the Shaoyang channels. Points are triple armor 5, GB20, and GB8. Third, clear heat from the governing vessel, DU14, DU16, and DU20. Fourth is the local migraine relief, TAIA. Use TAIA. So, chief point is the GB20, primary point for the wind heat migraine for the temporal headache or fever or neck stiffness. So you have to use distal combination LU11, LU10, LI4, LI11, and triple armor 5. So lung to large intestine to sensu, triple armor to gallbladder, gallbladder to DU meridian, and DU meridian to extra point. This is the sequence of the meridian circuit. Now, let us discuss the deficiency pattern. We discussed 8 excess pattern. Now discuss the deficiency pattern. All are requested, please open your videos. Why you are closing your videos? So deficiency pattern. So liver blood deficiency, kidney insufficiency, then chi and blood deficiency, and spleen chi deficiency with the flame. These are the deficiency pattern. So first discuss the deficiency pattern, liver blood deficiency. Liver blood deficiency. So while liver blood deficiency, we have to focus on treatment principle, nourish the liver blood and tonify blood, nourish the liver and the kidney, and extinguish the deficient wind and open the channels and relieve migraine pain. So when we observe the liver blood deficiency, the features, symptoms are chronic dull or the itching migraine, headache that worsen by the fatigue or the after menstruation cycle. Then dizziness, blurry vision, dry eye, pale complexion, numbness or tingling of the limb, and scanty menstrual period, flow, or amenorrhea, no menstruation. Tongue is pale and pulse, you see there is a thin, weak, or choppy. Friend, liver is responsible to supply the blood to the brain and the periphery. So when there is a liver blood deficiency, these symptoms are appear. So points are, first point is the liver 8. This is the chief point. This is the main point. This point nourishes the liver blood and liver in. Second point is the SP6. This point tonifies blood and in and nourishes the liver and the kidney. That ST36 tonifies chi and the blood, strengthen spleen to promote blood production. Okay. Bladder 70. This point is the imperial point for the blood. Bladder 70 is the on the back. This is the inflation point for the blood, and this point nourishes and regulates the blood. And bladder 18, this is the backshoe point of the liver. So backshoe point of the liver, this point nourishes the liver blood. Then CV4, REN4. This point nourishes the blood and essence and support the constitutional deficiency. And GB20 nourishes the head and extinguishes the deficient vein and relieve migraine. Then GB8, this is the primary local point for the temporal migraine. Then Taiyang. This is the local point for the migraine relief. And D20, this raise clear yang. D20, raise clear yang and benefits the brain and relieve the chronic headache. Li4, move chi to enhance the blood. And Li4 move chi and enhance the blood circulation and relieve headache. So needling technique. So tonifying points are the liver 8, SP6, ST36, bladder 17, bladder 18, and CV4. And E1 technique for the GB20, GB8, Taiyang, and DU20 and LF. You have to give moxa to ST36, CV4, and bladder 18. And when there are no sign of the excess heat and patient has marked deficiency or cold, so you have to use the moxa, ST36, CV4, and bladder 80. You have to retain needle up to 20 to 30 minutes. Then maintain the meridian circuit. You have to prick this point with the sequence CV to ST, ST to SP, SP to liver, liver to bladder, bladder to GB, and GB to DU, DU to LI, and LI to Taiyang. So, number one, you have to use the point CV4. This point nourishes the blood and the essence. This is the root. Then number two, generate chi and the blood. Okay. ST36 and SP6. ST36 is the granary point, and SP6 is the tonifying point of the lower in meridian, 3 in meridian. Number three, nourish the liver blood. So which point? It is the liver aid. Liver aid. Number four, strengthen the liver blood via Bapshu points, which are bladder 17. This is the inflation point for the blood, and bladder 18. This is the Bapshu point of the liver. Number five, benefit the head and extinguish the deficiency weight. For that, we are using the GB20 and GB8. Number six, raise clear yang. Which point? DU20. Number seven, move chi and relieve pain. So, which point is the chi mover? LI4. Then number eight, local migraine relief, that is the Thai. Okay. Now, then next pattern, deficiency pattern, kidney indeficiency, also cause the migraine headache, kidney indeficiency. So treatment principles are nourish kidney in, nourish liver in. Okay, kidney is the mother and liver is the son. Anchor rising yang, extinguish deficiency wind, and benefits the brain and the marrow. So kidney fills up the marrow, relieve migraine. So in kidney indeficiency, symptoms are chronic recurrent migraine and dull or throbbing headache, and always affecting the vertex or the occiput. Dizziness and tinnitus and blur vision, dry eyes, dry throat, night sweats, thigh center heat. Okay, palm, foot, okay, foot and palm and chest, thigh center heat. Low back soreness, kidney indeficiency, na? So low back soreness is there, and weak knees. Knee will be weak. And insomnia, kidney indeficiency. It is the false heat. Red tongue with the little or no coating. Thin and rapid pulse. So points are kidney 3. This is the main point. This is the chief point. So this point nourishes the kidney in and strengthens the kidney. With kidney 6, this point nourishes the kidney in and moisten the dryness and benefit the throat. SP6, tonify liver, spleen, and kidney in, nourishes blood and the in. The liver 8 nourishes liver blood and liver in. Then bladder 23, backshoe point of the kidney. Bladder 23 is the backshoe point of the kidney. So this point strengthens the kidney in. Then CV4. This point nourishes the in and essence, and this is an constitutional deficiency. Constitutional, that is the it's follow from the birth. Constitutional. And GB20, this point subdue liver yang and extinguish wind and relieve migraine. GB8, primary local point for the temporal migraine. GB20 benefits the brain and release the clear yang and relieve the chronic headache. Tai yang, local point for the migraine relief. And LF4, this point move chi and relieve headache. This is the analgesic point for the body. Now, which point to sedate and which point to tonify, and which is the even method. And you have to give the moxa or no, because in deficiency, it is a heat pattern. So there is no moxa. Okay, so you have to tonify kidney 3, kidney 6, SP6, liver 8, bladder 23, and CV4. And we have to use even method, no tonification, no sedation. GB20, GB8, TU20, Taiyang, and LI4. And return needle for 20 to 30 minutes. So meridian circuits is the CV to kidney, kidney to SP, SP to liver, liver to bladder, bladder to GB, GB to DU, DU to LI, LI TIA. So you have to first nourish the in. Number one, you have to nourish the in. Points are CV4 and kidney 3 and the kidney 6. Secondly, this sequence, remember this sequence. First sequence, you have to nourish the in and the essence. This is the root. CV4, kidney 3 and kidney 6. You have to nourish the liver. Secondly, you have to nourish the liver and the kidney in. Point is the SP6 and liver 8. Then third step, you have to strengthen the kidney function. Point is only bladder 23. Fourth step is that you have to subdue liver yang and extinguish the wind. For extinguishing the wind, famous point is the GB20. GB20, and you have to use GB8. Number 5, step number 5, benefit the brain, it is the DU20. Number 6, move chi and relieve pain, it is the LI4, it is the analgesic point. Number 7, local migraine relief, it is the Taya. Now, last pattern, deficiency pattern. So Qi and the blood deficiency. Deficiency pattern is the Qi and the blood deficiency cause the migraine headache. Treatment principle is the tonify Qi, nourish the blood, strengthen the spleen and the stomach, nourish the liver, raise clear yang to head, and relieve migraine pain. When we are discussing the Qi and the blood deficiency, symptoms are, its features are chronic dull headache or the migraine, and headache that was by fatigue, overwork, or prolonged illness. Then bitter, it's better after rest. That headache or migraine, better after rest. Fatigue and general weakness. Then dizziness, pale complexion, palpitations, poor appetite, pale lips and nail, pale tongue with a thin white coating, and weak or fine pulse. Points are HT36. This is the chip point. This is for why chip point. This is the granary point of the body. HT36 tonify Qi and strengthen the spleen and the stomach, promote Qi and blood production. Then SP6, this point tonify Qi and the blood, strengthen the spleen and nourishes the liver and the kidneys. Then bladder 20, back shoe point of the spleen, bladder 20. Remember, back shoe point of the spleen and strengthen spleen Qi. Then bladder 17, this is the infusion point for the blood, nourishes and regulate blood. CV6, this is this point tonifies original Qi and strengthen the overall vitality. Then CV12, strengthen the spleen and the stomach and improve Qi production. Liver 8 nourishes the liver blood. GB20 benefits the head and relieve the migraine. GB8 primary local points for the temporal migraine. D20 raise the clear yang to the head and relieve the chronic headache. Li4 regulate Qi circulation and relieve headache. Taya local point for the migraine. So you have to tonify HT36, SP6, GB20, bladder 17, CV6, CV12, and liver 8. You have to tonify. And even technique, no tonification, no sedation, GB20, GB8, DU20, Li4, and Taiyang. And moxibation. You will get a PDF now. Instantly, session will be finished. Okay, so you can read the points in the PDF, and you have to give the moxibation. So on points HT36, CV6, bladder 20 and CV12. Use the moxibustion. When you can use the moxibustion, when there are no signs of heat or excess. Return needle up to 20 to 30 minutes. And meridian circuits is the CV to ST, ST to SP, SP to liver, liver to bladder, bladder to GB, GB to DU, DU to LI, LI to thigh. So you have to use the CV12 and CV6 for strengthen the middle GAO and tonify yon chi. Secondly, ST36 and SP6 for generate chi and the blood. Third sequence is the liver 8 for nourishes the liver blood. Then next sequence is the bladder 20 and bladder 17 for strengthen the spleen and regulate the blood. Next sequence is the GB20 and GB8 to benefits the head. Next sequence D20 raise clear yang. Next is Li4 to regulate chi and relieve pain. And last Taiyang to this Taiyang to local migraine relief. So ST36, this is the chief point. This is a principal point for the tonifying chi and the blood by strengthening the spleen and the stomach, because this is the granary point. Remember, ST36 is the granary point. So distal tonification combination is the CV12, CV6, ST36, SP6, and the liver. And this sequence follows the meridian progression. So, Renmai to stomach, stomach to spleen, spleen to liver, liver to bladder, bladder to gallbladder, gallbladder to duomy, duomy to large intestine to extra point, thyla. And this order treat the root deficiency, that is chi and the blood deficiency, by restoring the body's ability to generate chi and the blood before treating the branch manifestation, that is the migraine. Branch is the migraine, but root cause is the blood and the chi deficiency. Now, last pattern, spleen chi deficiency with the flame. Spleen chi deficiency with the flame. When we are thinking about the spleen chi deficiency and flame, we have to treat, we have to follow the principle to tonify spleen chi, strengthen the spleen and the stomach, transform the flame, resolve dampness, Raise clear yang to head and open the channel and relieve the migraine pain. So symptoms are chronic or recurrent heavy migraine, dull or heavy migraine. Head feels heavy or wrapped in the cloth, wrapped in the cloth. Head is heavy, feel heavy or wrapped in the cloth. Headache that worsen with the fatigue or the after eating greasy food, dizziness or vertigo, nausea, excessive sputum, flame. So Hindi is not possible because here is the international public, international students are here. So Hindi बोलो. Okay, चलो. Alice, are you okay with Hindi? Okay, okay. No. तो स्टमक 36 ये मेन पॉइंट है, मुख्य पॉइंट है, मेन पॉइंट. दिस इज द मेन पॉइंट, स्टमक 36. दिस पॉइंट टोनिफाई ची, ची को बल देता है एंड स्ट्रेथन द स्प्लीन एंड द स्टमक, प्रमोट ची प्रोडक्शन. Then ST40 chief point for the transforming the flame and clearing the head. Stomach 40 मुख्य पॉइंट है, वो फ्लेम को ट्रांसफॉर्म करने के. कई वर्ड है वो इजीली हिंदी नहीं बोल सकते हैं. ओके, एंड क्लियरिंग द हेड. SP3, this is the yawn source point of the spleen. yawn source point. ओके, नंबर थर्ड, तीसरा तीन नंबर पॉइंट है ये SP3. वो पूरा मेरिडियन को बैलेंस करता है. yawn source point, yawn source point ये वो किडनी का एनर्जी. ओके, इस so yawn source point that hold the kidney's energy. Then spleen 6, SP6, tonifies spleen chi. स्प्लीन का ऊर्जा को टोनिफाई करती है. रिजॉल्व ड्रैमनेस को खत्म करती है. हार्मोनाइज स्प्लीन एंड लिवर एंड किडनी. SP9 ड्रेन डैम्पनेस को ड्रेन करता है एंड प्रमोट फ्लूइड एंड मेटाबॉलिज्म. Then CV12 harmonize the stomach, strengthen the spleen and transform flame. Then bladder 20, backshoe point of the spleen. Okay, backshoe point of the spleen and strengthen the spleen chi. Then GB20, strengthen the head and dispel the weight and relieve migraine. GB8, this is the primary local point for the temporal migraine. हाँ, ये एक प्रथम पॉइंट है जो टेम्पोरल माइग्रेन ओके को ट्रीट करता है. DU20 रेज क्लियर यांग, क्लियर यांग को ऊपर उठाता है. रेज क्लियर यांग टू हेड एंड रिलीव क्रोनिक हेडेक. LI4, this point regulate chi circulation, regulation करता है and relieve headache. And Taiyang, this is the local point for the migraine. Taiyang ये स्थानीय पॉइंट है, स्थानीय बिंदु माइग्रेन के लिए, अर्धशिशि की जो आधा सर दर्द के लिए. Then meridian circuit, CV to ST, ST to SP, SP to bladder, bladder to GB, GB to DU, DU to LI, LI to thyroid. So first point is the CV12. Second, this point strengthen the middle Q root. Then second points are ST36 and ST40. This point tonifies spleen and the stomach chi and transform flame. Third is the resolve dampness. Strengthen the spleen. For this, we are using SP3, SP6, and SP9. Then bladder 20. This point reinforces the spleen chi. Spleen chi को बढ़ाता है. Then GB20 and GB8 for treat the migraine to branch. GB20 and GB8 migraine को ठीक करता है. DU20 raise clear yang. Then LI4 regulate chi and relieve pain, and in tongue local migraine. Okay, now let us discuss on the master tool acupuncture for migraine pain. Okay, migraine treatment, master tongue acupuncture, generally needle on the contralateral side. Suppose right side migraine, okay, needle on the left side. If left side migraine, needle on the right side. So 88.25. This is the GB31 and GB32. These 2 points treat all types of pain, GB31 and GB32. It is the 88.25, GB31. So I'm showing you GB31 and GB32. Okay, see, when you stand erect and keep your hand parallel to the thighs, where your middle finger touch to the thighs, It is the GB30. Okay. See, very simple procedure to locate the GB31. Alice, stand and show the GB31 by location GB31. Okay, when you place your hand parallel to your thighs and where your middle finger touch, that is the location of the GB30. Okay, and GB32, okay, on the lateral aspect of the thigh, 5 proximal to the popliteal crease between the vetus lateralis and the bicep femoris muscles. Okay, so this is the GB32, 5 lateral from the lateral corner of the patella of the popliteal crease, lateral end of the popliteal crease. Okay, behind your knee. Then next point is the dabai and lingu and dabai. Okay, showing you the next point, lingu and dabai. Okay, this is the dabai 22.04. 22.04. This is Li3, Li3 in the TCM. In master tongue points, it is the dabai 22.04. And 22.05, this is the lingu. This is the junction of the first and second metacarpal. Junction of the first and second metacarpal. This is a very famous point. These 2 points are very famous for lumbar pain, for sciatica. Okay, so we will discuss after when we will discussing the lumbar pain and the sciatica. Then next point is the ST36. And ST36, you know location of the ST36. And next is the 77.22, 77.23, and 77.22 and 70.23. It's near GB34. See, this is the GB34. And on the tibia bone, okay, tibia bone, okay, distal to the GB34, 77.22 and 77.23. Then 66.05. This is the ST43. and 66.09. See, this is the 66.05. This is the ST43 in the TCM. And 66.09. See, on the between the fourth and fifth metatarsal bone at the junction of the fourth and the fifth metatarsal bone. Then 66.12, this is the kidney 2 point, 62.12, 66.12. This is a kidney 2 point. Overlap to kidney 2. Okay. Then pericardium 6, you know this point location. GB60, you know this point location. Then guide points are the GB4 and GB5 and GB20, DU20. So guide point also always needle on the same side. So friends, in TCM, migraine is the considered a symptoms rather than a single disease. This is, and treatment is based on the correct pattern identification. There are the 12 patterns, 8 excess pattern and 4 deficient pattern. When migraine patients come, you have to identify the patient. If you want to treat the migraine permanently, you have to go with the pattern. So, location of the headache help to identify the affected meridian. That is, that meridian may be gallbladder, bladder, stomach, liver. While the underlying TCM pattern, such as the liver yang rising, blood stasis, or flame dam, this determine the treatment strategy. Okay, so now I am handovering the session to my beloved student, Alice. Alice, let's try to summarize this session. Alice, you are unmuted.
Good evening. Today we finished the excess patterns. One of them was damp heat, another was wind cold, and the last was wind heat. In excess pattern, we need to decide which pattern we have and to treat according to the principle. If we have a damp heat, we need to clear heat and damp from the meridians and harmonize middle jaw. The symptoms are very important in this in the understanding the pattern. So in damp heat, we are speaking about temporal headache, heaviness, nausea, dizziness, and hypochondriac fullness or pain. Also, sticky stools and greasy tongue will be a good sign for this. The primary points is to harmonize Shao-Yang channel by using gallbladder 34 and gallbladder 40, and also liver will be very important. For damp heat, we will use the primary point of stomach 36 as the supporting point for transformation of dampness. In case of wind cold invasion, we will find features like acute headache, vertical or occiput headache after the exposure to the cold. There will be no sweating at all, clear nasal drip, a thin white coating that will give us the feature of the cold. And the wind, we know that we were exposed to the wind, and then our pattern for the migraine will be wild cold. Then the main points will be connected to the wind, to expel the wind. It will be gallbladder 20 as the prime point for the wind, as well as bladder 12 and bladder 10. DU16, all this line is line for the wind and heat wind expel. And the points that we will take care for the wind and headache is large intestine 4 and lung 7 is important here as the wind cold. As the wind cold pattern, we will use heat as the moxibustion. So where we will have a pure cold, we will use mox. It will bring yang and qi inside of the system. In case of wind heat, the feature will be acute pain after the heat wind explosion, sore throat and yellow nasal discharge. The main way to treat this will be release the exterior and clear heat. So the main points will be GB20, DU14, DU16, large intestine 11 and triple warmer 5. They will all reduce heat. In case of deficiency, we have 4 patterns: liver blood deficiency, kidney insufficiency, qi and blood deficiency, and and spleen qi deficiency. So as earlier, we will treat according to the pattern. If we have the problem with the liver blood deficiency, we will nourish liver, blood, and kidney. Usually the features will be chronic migraine, worsen with after menstruation or fatigue. As the liver and blood, we will have the features of dry eyes, tingling of limbs, dizziness, scanty menstrual flow, choppy pulse. So we need to supply liver blood and bring blood to the brain. The main points for the blood is liver 8. So the blood is liver 8 and the bladder 17. There we will take care of the blood, and we will bring by DU20 to the head, and we'll use the local points to treat the migraine. In case of kidney insufficiency, the principle will stay the same. We will nourish the kidney in and liver in. kidney insufficiency, usually we will see the chronic recurrent migraine, stabbing pain aside, usually effective occiput and vertex headache, liver in deficiency will be symptoms of dry eyes, 5 palm heat, low back soreness, knee weakness, insomnia as the signs of the heat, false heat. What will be important here is to treat in, and the primary points will be kidney 3, kidney 6, and as well if we treat in, part of this is the blood, so we will also use liver 8, and to nourish the organ and function we will use bladder 23 as the backshoe point of the kidney. In case of deficiency, Qi and blood deficiency, of course we will take care of all the supply chain and production chain of Qi and blood. So it will be, in case of Qi, it will be stomach, spleen, liver that gives the flow and regulates amount of the flow of the blood in the system. First of all, the symptoms will be chronic dull migraine, worse with overwork or long illness, and of course it is better after the rest. The main points is everything that is connected to the Qi, stomach and spleen. Stomach 36 is a primary point here to produce Qi, and Qi is the mother of blood, so stomach 36, spleen 6, and bladder 17 that will give us the blood. Then we will bring blood by liver 8 to the brain, and the brain will give a blood by DU20. In case of Qi and blood deficiency, it's good to use moxa to activate the middle jaw for production Qi and blood. In the last symptom is spleen Qi deficiency with phlegm. The first way what we have to do is tonify spleen Qi to regulate the middle jaw and to expel the phlegm from the system. So the main points will be spleen 3. It's one point when the spleen gets the extra Qi from the kidney to come back to its own function, to enhance, to strengthen the prime function of the spleen. And of course, stomach 36, stomach 40 will transform phlegm and clear heat. And if I summarize better the main points we have for the system, for the flow, and for the local treatment of migraine. For the local treatment of migraine, we use GB8, GB20. To bring energy and the Qi, we use Li4 and Tai Yang. These points are primary and for the migraine, and all other points we use to take care of the pattern that brings us for this symptom. And as you said before, migraine is a symptom and not disorder according to TCM. That's it.
Thank you, Alice. So, thank you very much for joining this 2 days workshop on migraine headache. Okay, so I will always come online to your service and bring you more knowledge. So thank you very much. Ending the session. Namaste.